Senators could have done something. Well, they're finally in play, so be safe out there, guys, and don't get a ticket because I know you guys are hurting for money. I don't know how you're going to pay for that with the PUA running out at the end of the month, so end of the year. 8:10. Let's go to the KUAV News Zoom room where Dr. Hoa Nguyen is standing by. He's the chairman of the Physicians Advisory Group, and they normally have meetings on Thursday, right, Doc?
Yes, but yesterday was Thanksgiving, so we don't have a meeting yesterday.
I know.
Next,
Next week, right? So you guys didn't have a meeting yesterday because you were staying home for Thanksgiving.
yes,
Right
we're
on.
all staying home for Thanksgiving today.
Doc, so what are we looking at? We just had Dr. Ann on, and the car score is down to it's at 6.8. We're almost to 5. We should get like a cookie or something. Like we're getting a reward for striving for 5. How about like 6.8? Do we get anything for 6.8? It's looking good, Doc. Or
Uh, no, we got to get down below 5.
okay, okay,
So almost there.
right. And so
Like I said, we no, we doing a good job and keep the cost more going down. So that again, this taking out the cluster for the construction company and taking out cluster for DOC, our cost going to go down. Now the challenge is this week and next week, we will see if Thanksgiving did any damage or not. So we just prepare for the cost score to go up. Hopefully, not too much in the next 7 to 10 days or so. And if the if we do the contact tracing and everything well, then we should push it back down before Christmas. But that's the challenge is to the public and also the challenge for public health is those two have to work together to try to keep the cost score down before we get to Christmas. But um, again, what happened yesterday, we'll um, we'll see about 5 to 10 days from now. So let's keep our finger crossed that people did the right thing yesterday, and everyone will do well. So again, we will find out the next week, 10 days.
So you hadn't heard anything about anybody going buck wild for Thanksgiving?
buck wild, Doc. It
Um,
means it
no,
loosely
because
translates to it's crazy. Okay.
I don't see anything yet. Yesterday we
Okay,
actually
that's good
stayed
then.
home. We didn't go nowhere.
All
So
right.
no, yeah, I didn't drive out the island like during the weekend just to see how people does. But hopefully, a lot of my patients are did modify the Thanksgiving,
Mhm.
and I appreciate them they doing that. So hopefully we don't see anything big coming out of it.
Good.
But we will see. But the cost has been going down slowly for the past
Slowly.
week to 10 days. At the cluster, again, the cluster from construction company is doesn't have much an impact on the community at all from what the data I see. But the cluster from DOC, because the people, the employee and the guard, everyone live in the community, so it does have some impact in the community when the DOC cluster occur. So, um, like I said, they try their best to do the contact tracing. Hopefully, it contains the DOC cluster um, and not being spread out to community so much.
So that's the message you're getting from your patients. They're saying, "Hey, Doc, yeah, Thanksgiving's coming up, but we're going to kind of tone it down."
Yes, a lot of people are not, the house to house. They don't interact. They stay from their house, and I think quite a few people are listening to the advice, and not mingle so much from house to house. So hopefully it works. I don't know. Like I said, we keep our finger crossed. We told our staff that get ready to be busy in the next week to 10 days. And hopefully, we are wrong on that message. So
Right.
we won't, yeah. But it's good, so we're gonna do some more thought on Thursday on the testing at the airport again. We really have to start doing that with the Christmas holiday coming back and in a few weeks. So hopefully we can get people to go home a little bit early. But we're going to try to push that issue.
Right. So, what is the protocol or plan then for this testing at the airport? Because we did have GVB and GIAA on Wednesday talking about the surgeon cell that they have their own sort of plan well, actually they didn't say it was a plan, their guidance for testing at the airport. And then you had GVB who was recommending this humanity, I think, for wellness type of program, which includes an app.
Yeah, the surgeon cell have a very good plan, and for testing the airport. That's probably the one that is going to have the biggest impact. The we like to have, if they can, have a pre-arrival test. But I understand now on the news that the pre-arrival test, because the surge in the United States is so high, that the 72 hours pre-arrival test might not be a reality, because even CVS say that they cannot guarantee the 72 hours anymore. Maybe it take about 5 to 7 days now. So that one is a key factor for us. And I know that we have the ability to do testing in the airport now with the Bimax antigen part that we can use to screen people and maybe cut down the quarantine in the hotel down to 5 days and then testing out to go home. That's one option. The other option is that we test the airport and send people home and have a very robust home quarantine that will be help people accountable for to be testing out from home on day 6 to day 7. But those are the options that we had to throw on the table. Like I said, it's nice to kind of get people home early for Christmas, so that we don't have to spend, long in the quarantine hotel. Even maybe, kind of shaving the 7 days down to 5 days. 2 days shorter is better than nothing. So we're gonna try to push that again. So that way people can go home early for Christmas. So that's what we're going to talk about. I'm going to put out an agenda for Thursday, and we're going to really have to hammer that issue out. Probably about a few more weeks from Thanksgiving.
Doc,
from Christmas.
What's the protocol for travelers coming to Guam from the CNMI?
The people from CNMI, you mean from Saipan?
Yeah.
Yeah, from Saipan, they still have to be quarantined, in the hotel for 6 days testing out and go home day 7. It's still the same thing. The only one that really have no quarantine is the one from Palau, Chuk, and Yap. They have 0 case there. So the FSM resident, when they come in, they go home because there's no case in any one of those islands.
Are you sure, Doc? I thought I heard, and correct me if I'm wrong, but I thought I heard if you're coming from the CNMI, you have the option to home quarantine instead of quarantine at the hotel. But I mean, you would know, so that's why I'm asking.
No, I think so. They, from what I know, they still gonna be quarantined. Because CMI still have case there. Yeah. They very little compared to us, but still, I don't think that's an exception. Only. From what I understand, only the FSM island that would not be quarantined at all.
So you got if you're in the CNMI, you're coming back to Guam, take a flight to Chuk first, and then from Chuk to Guam.
I don't think Chuk will allow you to do that. They're pretty strict. Those islands pretty tight down. So basically, you can't even fly there at all. Unless they have a very stringent 14 days quarantine somewhere before you fly to the island. So you got to be tested. So that's why, as I read in the newspaper yesterday, that there's a few islands in the world that basically is 0 COVID just because they shut down any type of travel. Right. And it's very strict on those things. So CMI, they still going to be quarantined.
Doc, you know how the CAR score is at 6.8 now, and when we strive for 5, if we get to like 5, would the physicians advisory group then make recommendations to the governor, and what would those recommendations be? And how soon after reaching
You
5
know, I mean,
would we implement them?
you know, you have to reach down to 5, and you have to stay down to below 5 for 10 days or 2 weeks. You know, you cannot
They
just
didn't
get
say
down to
that.
5 and then bounce back up. I'm sorry, but
They just said
you
strive
know, you
for
gotta,
5. You know, I thought that was the finish line. That's it. I didn't know we got to strive for 5, then we got to hold it there for 2 weeks.
you
Well,
gotta
it kind of makes
Yeah.
sense. Right?
Yeah, I know it doesn't.
to make sure, at least a week to make sure it's working. But you know, you can
Oh,
relax,
damn, man.
we really want to push for dining in, you know, for the restaurant. I mean, to me, they should open the restaurant on a dine in. Even from my opinion, that even now, you know, just because, you know, I think that Home Depot and Kmart and there's so much more people in those places than just dining in, and just have 25 to 50% people for dine in, and they 6 feet apart. You know, so to me, I think that's the first thing we want to try to recommend, and relax the dining in restaurant, so that way people can go out and enjoy time with their family in the restaurant.
But Dr. Fauci said restaurants, bars, and community spread are, I think, the 3 big ones.
Yeah, I think the bar is the biggest part. The people drink and the behavior is different, and it's loud. They have to get closer. But I think again, the restaurant part, there's really don't have much data out there, even in the United States, to tell you that you know, restaurant are a place where at high risk. You know, I think some restaurants have bar attached to it, and that's different. You know, have to isolate the bar side and the restaurant side, and not open the bar side. But I think there's not really data in the state for restaurant as high risk area. You know, so I think that's if we get down to cost point 5, the restaurant will be the first one we're going to recommend for dine in at you know, at least 50% capacity or something. But they a lot of restaurants in Guam, they do a very good job in you know, their guidelines to try to keep the infection to be spread in the restaurant. So
Yeah.
that's but again, we need to go down to below 5, and we have to stand there at least a week or so, or 2 weeks before we can do anything. So
Right.
I think we can do it.
Of course we can do it.
Yeah, it's up to our people to do it. You know, I don't think that put fine a vaccination be the key, but I think it's up to ultimately it's up to our people to do it. So it's all about us.
Doc, I wanted to go
But
back.
we can do it.
I wanted to go back and talk about that rapid testing at the airport and the pre-arrival tests and what have you. But you said those Biomax or whatever it's called tests. Binex, what?
Binex.
Okay.
It's Binex. It's BINAX antigen card.
You had mentioned this before, and I thought, and public health was talking about how they were going to use these possibly for the mass testing that they plan on, or community testing that they plan on reintroducing. Can you explain? Because when we had you on, you said they were for symptomatic patients.
Yeah, you know, we have at first that's the guideline from FEMA, but then the Surgeon General pushing for the Binax to be used for screening. You know, again, you know, it's not 100% like the PCR, but we do that. It gets 60-70% better than nothing, and it's really fast. You know, it's 10 to 15 minutes. And it doesn't need any machine, any device to do it. It's just like a card. So that's something that, again, we will miss some, but if we can catch 67% of people in the asymptomatic that carry the virus, it's better than nothing, right? So PCR take at least a day or 2 to run. So it's something that we do a whole lot. And we do a lot of education on monitor the symptom. We can go forward with that, you know. So again, we use the best tool that to move, and the one that's the cheapest, right? I mean, those things are at no cost from HSS, rather than PCR costs you anywhere from $100, $120 to run. So that's why the logic is use the Binax as much as possible.
Okay, so the plan is this is the surgeon cell plan.
No, this is the United States Surgeon General. It's
No, no,
not
no.
just,
I'm talking about the rapid testing using the Binex
Yes.
rapid test. This
Yeah,
is
that's his recommendation.
okay.
So,
And then
I
if
think
they test negative, you would be able to home quarantine.
either that, or we can shorten the quarantine day from 7 to 5, or the option 2 is to home quarantine. But home quarantine, we really have to have a very firm guideline of you need to show up somewhere to be tested out at day 6 or day 7. You know, just like in Saipan, they put a big bold letter there. You don't show up, you're gonna get a big fine, and they come after you. You know, and well, Saipan, you gotta give them credit. They do follow with the guideline, and they show up to be tested. And that's what we need to do. Is basically make sure that we hold people accountable for show up on the date they're giving to them, and the time, the place that they show up to be tested. That's the problem in the past, if people didn't show up. But if we really give them an appointment time and a date and a place for them to show up, and hold them accountable for that, I think it will help a whole lot. If people want to go home early, they need to follow the guideline. And like I say, it's not the government. It's people that need to be, adhere to the measurement that the government put there, and we can go forward with that. So again,
when is
those are two options.
When are we looking, or when does the surgeon cell want to see that happen? This new rapid testing protocol.
We're going to talk on Thursday. We're going to reapproach that point again, and they have their plan together already. It's a matter of GVB, public health, and the governor will bless it, and we can go forward. Okay. That plan we put forward now for I think months already.
Which plan? The one from the surgeon cell, or the one that Uncle Carl and those guys are trying to do?
Surgeon cell put that plan a long time ago, okay. and it's a very well thought plan put together. It's just in the past we don't have the ability to do testing at the airport, but now we do. So it's time to put forward. They put this thing together a long time ago. It's just that by using Abbott or PCR testing, it's just that have a bottleneck there that will hold up the line for a long time. That the antigen card is very fast. You don't have a bottleneck. So,
what about do you have any updates on Bamlanivimab?
Say that 5 times fast, Bree.
Bamlanivimab.
You can't even say it, Doc. Come on. He's like.
They doing good. They give a few IV infusion in the ER already when they identify person at GMH at COVID positive and don't meet the criteria for admission. So they're giving their few doses, and then GMC also had an infusion tent that the clinic referred to for them to use it. Again, it's a monoclonal antibody, and it's not Regeneron like the president have, but it's equivalent concept to it. So far we don't hear any bad outcome come out of it, and but they're going to monitor again. The Surgeon General encourages to use it. It try to cut down the hospital admission, so kind of keep people as an outpatient, especially the one that meet the criteria, the comorbidity like diabetes, hypertension, and heart disease. Those guys need to have the infusion, so that way their chance to end up in the hospital a lot less.
Have you referred anybody?
We refer quite a few patients to GMC already. GMH will give the infusion in the emergency room, once identified at GMH, but they don't have the capacity to do the IV infusion outside the tent. And we don't want to overwhelm GMH either, so that's why GMC has stand up on their infusion tent and refer patients from the clinic to GMC. And the process is very smooth. So far we have nothing bad come out of it, and patients appreciate that because they all get anxious, especially the one that have comorbidity. And if they can take a infusion that that minimize the risk of getting worse, oh yeah, I would put anyone on it. So far, all the patients, I'm very glad to have it, and I follow up on the patient. They get treated very well, and there's no side effect, and they go home after an hour after the infusion, so it's good.
So the patients, at least on your behalf, that you've referred over to GRMC for this antibody treatment, have all done well or are doing well.
Yeah, Sabrina, yeah. I mean, that's what we try to put a message out to the provider in the community that if you will do testing in your clinic, and you should kind of spend time talk to the patient and screen to make sure that the patient have the right comorbidity, the right criteria, and then do the referral. This is very, very efficient, very fast. Again, the more we can do to keep them away from the hospital, the better. So, again, everyone possibly encourage them to either get a pulse oxygen, measure the oxygen at home, because that's the part where people doesn't know they drop the oxygen saturation so low that when they become symptomatic, it's kind of too late already. So those are the two big things we try to talk to the patient, educate them, and somehow measure the pulse ox. Just like for our clinic, we purchase a whole bunch of pulse ox, and we start giving out to the patient to go home to monitor pulse ox and what to look for. So that way they know where the oxygen is, and when they finish, they will return the pulse ox to the clinic afterward.
And just so the community is aware, the Guam Memorial Hospital did receive 50 vials of this bamlanivimab antibody treatment, and 25 went to GRMC, and then 25 are at GMH. Do you know? So once we use up all these 50 vials, we make a request to HHS for more. How does this work?
Yeah, I think that if HSS thought that we use the IV infusion, that will give us more.
Is that why is this why we're starting to see the hospitalization numbers go down because of this antibody treatment? But there was another one that Lillian was mentioning, cryos. Do you remember, Chris? Cryotherapy or
it was cryoplasma
therapy or?
Yeah, that's a plasma therapy. That's different. That's not the one. But the reason the hospital go down because our positive rate go down.
Right.
That's this rate is called. You can see the high cost for the past 2 or 3 weeks or so, just because again it's a cluster. But community-wise, as the community positivity rate go down, the hospital admission will go down. But it still lag behind at least a week to 10 days or so. Once you see people positive in the community, it takes about a week to 10 days for the hospital to go up. Again, our hospital admission go down because the community positive rate are going down. For Thanksgiving, if you can see the positive rate in the community go up in about 5 to 10 days, and the hospital admission usually lag behind a week or so. So about 3 weeks from now, we can see the hospital go up or not.
How involved are you with this vaccination plan that the governor and lieutenant governor and public health are working on?
We are in the planning stage of number for storage. This storage is very important because it requires such a deep freeze on this vaccination, and also try to to plan out the priority list. You know, the priority list would be, you know, the frontliner, and then what we recommend is that the dialysis patient will be the next batch. You know, those are the most the highest comorbidity at the moment. So we have 300-400 of them, and they need to be prioritized first because, you know, we don't want to lose any one of them. Mm-hmm. You know, so those, and then they go down the list of who had the comorbidity from that. Mm-hmm. But you know, when it's going to come, I don't know. And there's a lot of politics in this thing, so maybe the end of December, early next year. But if I'm putting my basket, it would be probably early next year.
Okay. I think that's it for me, unless there's anything else.
Like I said, we're in the marathon, and I don't know which mileage we are, but you know, we got it ourselves.
All right, thanks.
Until the vaccine. Okay.
Right on, Doc.
Thank you, Doc.
Guys.
Appreciate it.
I gotta go, but be safe, and let's shoot down to cars below 5. Okay.
Right. I'm gonna aim for 0. Let's just aim for 0.
Be a hero. Shoot for 0.
Hero. Shoot for 0.
Shoot for 0 and be a hero.
Right on. That's it.
Or get it to 0.
You want to have fun? Get it down to 1.
We could go on and on, right?
We could all day.
Yeah.
Thank you, Doc.
Guys. Have a good day.
Appreciate it. Be safe. God bless you. God bless Guam. It's 8:36. We'll take a quick break, and we're going to come back and cue up this interview Sabrina was able to do with the Adelup Press Secretary, Crystal Paco San Augustine. Actually, and to clarify what Dr. Ho had just said, I reached out to Janella, who is the spokesperson of Department of Public Health. Mm-hmm. And she said that incoming travelers from the CNMI go straight to home quarantine. And I think that's because there was a ruling from Judge Elise Iriarte in the Superior Court. So just to clarify that.